Hello everyone, good afternoon. It's good to see you all again. Today we are on Doctors Go Live on Columbia Asia Hospital Facebook, and we have a very interesting topic today, a topic that is very common actually among Malaysians. So we have with us consultant interventional cardiologist and internal medicine physician from Columbia Asia Hospital Seremban, Dr. Kin Leong. Before we hand over the floor to Dr. Tan, let's just take a look at what exactly are we talking about today. So the topic is about heart failure, sometimes known as congestive heart failure. It occurs when your heart muscle doesn't pump blood as well as it should. It has become a significant public health problem with rapidly rising incidence and prevalence that is predicted to rise and continue into the 21st century. So this is a very serious matter. Okay, well, hello, good afternoon, Dr. Tan. How are you today?
Hi, Sakina. Hi, good afternoon. Good afternoon to everyone who is streaming live with us. Welcome.
Okay, thank you so much for making time to be with us. I believe today's topic is very, a lot of people can identify with it because Malaysians and their food, and then the heart disease follow. So there's a lot that we need to discuss. It's very important. So we'll be talking about symptoms, causes, and risk factors. I will just go straight into our first question. Basically, when we refer to heart disease, doctor, what are we actually looking at?
All right, Sakina. I mean, public usually when they talk about heart disease, it's actually a very broad and very general. Tell the doctors or tell the disease what they're really trying to mean is actually they have blood vessel blockage. But to be honest, heart disease is a very broad term. Anything that goes wrong with our heartbeat, our heart muscle, our heart blood vessel, our heart electrical system,
Yes.
Everything can call heart disease. That's a very broad and a very general term.
I see. What's the difference between heart attack and heart failure? I think some people think that this is actually the same. What's the difference?
Yeah, heart attack and heart failure are totally two different entities, I would say. Heart attack is implies as a blood vessel blockage, a blood vessel that's supplying to our heart. When there's a blockage occurs, and mainly due to cholesterol buildup in our blood vessels for years, the blockage and impeding the flow to the heart muscle, that is what we call as heart attack. And patient usually complains of chest pain, chest tightness, chest heaviness. And what you can see here, this is a diagram of our angiogram that we perform. This is the right side blood vessel. As you can see there, there's a very tight blockage there. And the next to it is actually, we have actually done a stenting, balloon and angioplasty to the right side of the blood vessel. Yeah, this is called heart attack.
I see. It's very clear. From that image just now, the narrowing of the blood vessels. Okay, sorry, doctor. Shall we talk about heart failure now? What is the prevalence of heart failure in Malaysia?
Well, let us talk a bit on heart failure. People, when they heard about the terms heart failure, or when the doctors tell them they have heart failure, they get very anxious, they get very frightened with this term. Heart failure doesn't mean that the heart is actually failing to the extent that the patient may not be able to function or they may have a shortened lifespan. But essentially, heart failure basically means the heart is unable to pump as efficient as it should be. So as you can see in the diagram, the diagram shows that the normal heart, and next to the normal heart, there's a heart that is enlarged. So that's what usually happens to a patient with heart failure. Their heart get enlarged. And this is also a diagram to show you how the heart can enlarge compared to a normal heart size. And heart failure, basically what you can see, if someone who has heart failure, to supply to the major organs in our body, be it to our brain, to our kidneys, to our other important organs in our body, right? So when we talk about prevalence of heart failure, it is a very important disease that affecting our Malaysian population. It is estimated that about 1 to 2% of our adult population in Malaysia will have heart failure, be it diagnosed or undiagnosed. And these numbers are estimated to double up in the next 10 to 20 years. And this number is actually very alarming. And what we can see from our data, 1 in 10 of medical admission to the emergency department is actually due to heart failure.
Oh, that's very scary. What is a typical patient profile of those who suffer from heart failure?
Who will actually get heart failure? So there's no one actually will be spared from getting heart failure. As you can see from this picture, it depicts that whether you are fat, whether you are slim, whether you are old or whether you are young, whether you're a man or a woman, you can potentially get heart failure. So we should not think that, we are young, we are female, we are slim, we won't get heart failure, because heart failure really can affect any group of patients.
What about the risk factors of heart failure?
Yeah, talking about risk factor, the most noticeable risk factor is being old. You see, well, of course, we want to age gracefully, but as we age, the risk of getting heart failure increases, and then other risk factor, for example, like smoking, double the risk, or even triple the risk of getting heart failure. Alcohol consumption. Alcohol consumption can actually be one of the risk factors as well. And high blood pressure is another important risk factor of heart failure. As we know, and you look at this diagram, central obesity or being overweight and obese is also another risk factor of getting heart failure. And you look at our Malaysia, this is showing that, Malaysia is one of the highest in Asian that has got diabetes, and Malaysian are also fattest in Asia. All these are actually risk factor of getting blood vessel blockage and subsequently leading to the risk of getting heart failure. And you look at our data as well, 1 in 3 of our adult population has hypertension. And 1 in 2 of our adult population has got high cholesterol. And also, you see, our culture is such, Sakina, we always ask people, sudah makan ke belum, So this is our culture. So, and then you see, this is our culture. We have an elevator, we have got a staircase, but we tend to choose to go, not to exercise, not to climb the stairs, but we take the elevator, And of course, you see Malaysia being rich with so many good food. So, those are the risk factors that we are facing of getting blood vessel blockage and subsequently heart failure.
Are these the causes of heart failure, would you say?
Well, to understand what are the causes of heart failure, I usually tell my patient, I resemble a heart just like the house. So if you want a house in a proper order, you need the wall structure, or the room has to be in order, the doors has to be good, the electrical system has to be running well, and the piping system of the house has to be good. So same goes to the heart. You need to have a strong muscle, you need to have a good valve, which resemble the doors of the house, that has to be functioning properly. The electrical system has to be working properly. Either it is anything goes wrong with the heart rhythm or the electrical system of the heart that can cause heart failure. And if let's say that any blood vessel that resemble the piping of the house has got blockage, that would actually cause heart failure as well. So let me just show you some of the causes. So this picture depicts muscle. Some patients born with a problem with the muscle problem of the heart. So what we call generally as cardiomyopathy. or if they have a heart, they will get heart failure. When the heart rhythm go too fast, they can get heart failure, or when it's too slow, they can get heart failure as well. So
Yes.
this picture depicts the valve, what I commonly tell the patient, the doors of the heart that ensure the blood flow go one way. So sometimes as we age or due to diseases that can cause all this heart valve or the door to be dysfunction, either it is too loose or it's too tight. In long run, that can actually cause heart failure as well. And as we know that the heart and the lung are closely connected to one another, so a patient who has got lung disease for a long period of time, they may actually get heart failure. To be specific, the heart failure of the right side of the heart. Yeah,
Right.
and emotion is very much connected to our heart. So some patients, when they get too stressed up or when they get too sad or due to whatever emotional tension or stress, they can actually get heart failure for a short period of time. This is what we call a Takotsubo cardiomyopathy, that's being recognized by the Japanese. And also, if you have heard before, Sakina, if a certain pregnant lady, they do get heart failure during pregnancy. This is a rare condition, but it does occur. And this is what we call as peripartum cardiomyopathy. In other words, it's a pregnancy-induced heart failure. And most commonly, I would say the commonest cause is still back to blood vessel blockage leading to heart failure.
I see. Okay. Actually, I've not heard of the having heart failure when you become pregnant. So that's new information and very scary as well. Is that a common thing that happens to pregnant women?
Well, it's
Or
not very common. But we do see them on and off. When pregnant lady, as the pregnancy mature with time, if they do find that themselves do get breathless out of proportion, well, we know that as the pregnancy progresses, a pregnant lady may have a bit of a shortness of breath, difficulty in breathing as they walk. But if the symptoms go disproportional, they should actually seek help to ensure that the heart is actually working fine. Yeah.
All right. So in order for us to know whether we are about to have heart failure, let's talk about the symptoms of this condition.
Yeah. When we talk about symptoms of heart failure, well, they are actually quite. There are patients who has got heart failure but go unnoticed. They're actually quite fine. They're quite well. Of course, there are some who present with tiredness as they work, as they walk, as they do their house chores. They feel tired easily. That's one of the symptoms as well. Or they find that themselves they have to sit up to sleep because as they lie down flat, they feel that they are short of breath. So that's also one of the symptoms of heart failure. And if they find that themselves coughing excessively, especially and at night, when the phlegm are usually white in color or a little bit of blood stain, pinkish color, that may actually be of heart failure symptoms. And sometimes a patient may go notice that their leg is actually a bit swollen. Both legs are a bit swollen, can be also a symptoms of heart failure. And also they may notice their tummy get a little bit bigger, bloated, distended. Well, we are not talking about fat here, Sakina, but this is really water accumulation in the stomach itself, in the abdominal cavity. So in short, if anyone who experience tiredness, breathlessness, and also swelling, those are the important symptoms that to tell the patient that they need to seek help and to seek medical attention quickly.
I see. Okay. So let's take a look at this question. Now, what are the methods used by medical professionals in order to diagnose heart failure?
Yep, to diagnose heart failure, one has to come to us, come to appropriate doctor, a cardiologist, to get The evaluation will start with some, history taking. The doctors will be asking questions to delineate whether the symptoms are really related to heart failure or is it something else, or be it a lung problem or other things. So then the doctor will just will do a very basic physical examination, looking at the blood pressure, the pulse. So the doctor will listen to the lungs and also listen to the heart and examine the feet to see whether there are signs that can tell us whether these patients are likely to have heart failure or not. I would say that if anyone who experiences the symptoms that I mentioned just now, or they feel that themselves they are having difficulty in breathing, I would suggest them to go to emergency department urgently, or if not, they may actually attend to our outpatient clinic to get further evaluations. The things that we can do will be simple tests. There's a blood test called NT-proBNP. This is a test that we can actually tell a patient who has got shortness of breath whether the shortness of breath is due to heart failure or is it due to something else. Is it due to a lung disease, asthma, pneumonia, or any other things? So NT-proBNP is one of the tests that we can do. And apart from that, chest X-ray will be able to tell us whether the patient who has got heart failure or not. And as Sakina, you can see there that the X-ray, the center part is actually the lung. The center part is actually the heart. This is a normal size heart. And as the patient who has got heart failure, you can see the heart is actually enlarged tremendously here, right?
It's very obvious.
Yeah. So X-ray will be able to tell the doctor whether the patient likely to have heart failure or not. And as the disease progresses or the patients will get very breathless, the X-ray will show that there's a lot of water in the lung area that I show here, the whitish area here, all the water in the lung. And you can see the heart shadow is actually very large, very big. And this is actually a very typical X-ray of a patient with heart failure and water in the lung. Yeah. And also, we also usually will do an ECG to help us to see whether the patient who has got possibility of any heart vessel blockage, or do they have any heart rhythm that is too fast that is causing the heart failure, or is it too slow that is causing the heart failure as well. And more importantly, we do have an echocardiogram, which what we call as heart ultrasound, that will give us a peek to the patient's heart as to how the heart actually is functioning. This picture is showing the heart is actually of normal size heart, and while this picture is showing the heart is actually enlarged. Yeah, Sakina, you can see that is it's actually very obvious. You see the normal size heart and enlarged heart. So our heart ultrasound can give patients or give us more confident in diagnosing the patients with heart failure. And apart from that, of course, a CT scan of the heart and MRI of the heart can tell us whether the patient who have whether they have got blood vessel blockage and whether do they have any other causes of heart failure as well. And if let's say the patient do have heart vessel blockage, we will perform an angiogram to look into the blood vessel of the heart and to see if there's any blockage. If there is, then we can do a ballooning and also putting a stent to the blood vessel that is blocked, and hopefully that will restore the blood flow to the muscle of the heart, and hopefully that will improve the heart function. If a very bad blockage, bypass surgery will be advocated there. Yeah.
Treatment that is usually carried out for heart failure.
Yeah.
Treatment options.
The treatment, I just need to tell everyone, if the doctors are telling you that you have got heart failure, please do not feel that it is this end of the day. I'm so sad that I have no hope. That's not true, because there are a lot of things that we can do right now. With patients with heart failure, with the things that we can do, we can actually prolong the patient's life. We can improve the quality of the patient's life, and also we can actually make them live as of normal. So let us just go through some basic management of patient with heart failure. starting off with diet and lifestyle modification. Yeah.
Okay.
First of all, heart failure patient need to have low salt diet. Low salt diet, because salt actually promotes or rather encourage water retention in the body.
Yeah.
So one who are diagnosed with heart failure, they need to reduce their salt intake.
Right.
There are a lot of things who has got high salt content, because a lot of patients telling me that, oh, I'm not taking a lot of salty things, but matter of fact, there are a lot of things do contain salt without them knowing. For example, in this picture, you can see that, nowadays we like to cook everything, salted egg prawns, salted egg chicken, salted egg, whatever not. So those are the things that contain high content of salt. Our sambal belacan, our soy sauce, ikan masin, our potato chips, some of the cured food like sausages, ham, and the tin food. All those things are contain high amount of salt that one should actually avoid. Yeah. And of course, being diagnosed to have heart failure doesn't mean that one should not exercise or they cannot exercise. But matter of fact, they should actually exercise because the heart need to be retrained. So one should actually do whatever they can. So, for example, if they can walk within the house compound, they should maintain healthy and maintain exercise. The activity that they can do, they should continue. Brisk walking, climbing stairs. As they do it in more frequent manner, they will find that they have got more stamina and they have more endurance in doing those activities. So exercise is very essential for heart failure patient as well. If one do get very afraid, they can actually see our physiotherapists or even our rehabilitation physicians, or get to seek help from to get a prescribed exercise, a graded exercise therapy with people that are expert in it. Other than that, we have got a lot of heart failure medication that we can help patients to live longer, to have a good quality of life. Medication that we can give, for example, simple medication just to help the patient to get rid of the excess water from the body. And also, there are certain medication that actually can strengthen the heart over time and to prevent water accumulation in long term. So those are the medication that the cardiologists and also physician can prescribe to the patients. So apart from that, we actually for those patients who has got heart failure that is not very responsive to medications, or they have high risk of getting sudden cardiac death, we do have device therapy. For example, what we call a battery in general term, a pacemaker. We do have that therapies to actually help the patients to live longer and also to improve their heart function. So this is actually what you can see here is actually an ICD. ICD is basically just a defibrillator that is implanted to the patient's heart. In the event if the patient do develop a cardiac arrest, this device will actually help to revive the patient or to restart the heart. This picture showing that, conventionally, when we see patient's heart stop, we will put in a defibrillator to just, revive the patient's heart. So by putting this ICD inside the patient's heart, we can actually help to prevent sudden, very dangerous heart rhythm that is happening in heart failure patients, and to help to revive or reset the heart rhythm of the patients. Another thing that this is called another more complicated device that we can actually put in for patients with heart failure to help them to improve their heart functions and their symptoms. And also in a very advanced stage of heart failure, we do have artificial heart pump that can help to help to take over the function of the heart. Now, of course, last but not least, heart transplantation is also one of the options for heart failure patients in a very advanced stage. So do not be dismayed or do not be discouraged when one being diagnosed to have heart failure, because we have vast treatment strategies or treatment plan that we can offer to the patients.
Okay, is there a cure for heart failure?
Yeah, I would say that most of the heart failure will not be cured, but they can be controlled, just like
Mm.
diabetes, high blood pressure. It can be controlled. So once the patient get their disease control, they can lead a normal or near normal, healthy life and a good quality of life. So by just doing a simple things like reducing salt intake,
Yeah.
reducing or control their water intake every day, measuring their weight to prevent excessive weight gain due to water accumulation in the body,
Yeah.
take medication regularly as prescribed by the doctor, and also remember not to miss their appointment, to go for regular follow-up. Those are the
Yes.
things that one can do to attain a control disease state. Yeah. Um,
How do we prevent heart failure?
Well, when we talk about prevention, Sakina, we have to go back to the main cause of heart failure. The main cause of heart failure is actually blood vessel blockage. So what we need to do is actually to prevent one from getting blood vessel blockage. So how do we do that? So we go back to the very basic uh, physical exercise. So we notice that, of course, a lot of people, they have a lot of excuses saying that I'm so busy, I have no time to
Yeah.
exercise. Yeah, with now the COVID-19, MCO, CMCO, where we can exercise. But I guess we tend to have a lot of excuses for not doing things, but I think rather we should give reason for us to do exercise. Yeah. A simple exercise, for example, just, brisk walking,
Mm.
walking up the stairs and down the stairs, doing a bit of house chores, gardening. Those are the things that if you do it in a regular basis in every day, about 30 minutes a day for 5 days, and you can rest 2 days. That's what I usually tell the
Yeah.
patients. That will come to about 150 minutes a week. That will do
Yeah.
good to our heart. Yeah. So this is number one, to maintain a good physical activity and exercise. Number two, so this is another diagram that I'm just showing, if you say you have no time, if you're at your workplace, get a bit of
Mm.
time to climb upstairs, down the stairs, you just find a time, during lunch period, lunchtime, just before you go home, or you feel
Yeah.
drown, you feel sleepy, rather than you take a short nap, maybe you just go walk up the stairs, down the stairs, park further a bit away, walk to the office, to help your wife to do some house chores, play with your kids. I guess those are the things that one can do. Yeah.
Yeah.
And secondly, of course, diet. We talk about diet. We have to maintain a very balanced and healthy diet,
Yeah.
low salt diet, low sugar diet, and more fiber, high fiber diet. For example, fruits and vegetables, cereal, oats. Those are the things
Mm.
that one should take more. So this is a diagram showing a plate. This plate showing a quarter, half. Yeah,
Yes.
quarter, half. How do we go about it? This is our plate. For example, we are going to take our lunch.
Mm-mm.
So quarter should be our proteins, our
Yeah.
meat proteins, half of it, quarter of it, and a quarter should be our carbohydrates, and the half of the plate, it should be fibers. It should be our fruits and our vegetables. That
Yeah.
is the ideal plate. As you see that our Malaysian, we have half of the plate is actually rice. Then we have another half of maybe meats. Then we do
Yeah.
not have a vegetable and fruits. Those are very unhealthy diet plate, and also a very not balanced diet. So that's what we should do. And apart from that, of course, stop smoking. Smoking do increase the
Yeah.
risk of getting heart disease and heart failure, and reduce your alcohol consumption, and
Mm.
also maintain an ideal body weight to prevent obesity. Well, we always talk about, well, I'm not obese, I'm not
Mm.
overweight, because
Mm.
Asian, we have a very small frame, but we have a big tummy. So that's a very important risk factor of getting heart disease and also subsequently heart failure. So what we talk about is if male, any one of you who has got your waistline more than 35, female, if you have got your waistline more than 31, I guess that's a call to actually do some weight reduction, go
Yeah.
for exercise, uh, maintain a healthy diet, cut down on your calories to maintain that healthy BMIs that you should have. And of course, though for those who have got high blood pressure, high cholesterol, and high sugar, you have to maintain, or rather, you should take your medication and maintain your good diet to achieve the target that's been
Yeah.
set by the doctors. If you have high blood pressure, your blood pressure should be below 140/90. Once you have achieved that, you should get your blood pressure down to 130/80. And you
Okay.
have got diabetes, you should get your fasting sugar less than 5.5, and your HbA1c, which is your average sugar for the past 3 months, it should
Yeah.
preferably be less than 6%. And if you have high cholesterol, your LDL should be less than 2.6. And more stringently, we want it to be less than 1.8, and even some patients, we want it to be 1.4. So do discuss with your doctors as to what are the targets that you need to achieve alongside with your doctor's management. Yeah. So yeah, Sakina. So I would urge that all do not, a lot of all these risk factor that I talk about and I spoke about.
Yeah.
A lot of times they are actually very silent and go unnoticed. So do schedule a heart screening. Just go for your yearly medical checkup. Because if you don't do your checkup, you will not know whether you have high cholesterol, whether you have got high sugar, whether you have
Yeah.
got high blood pressure. So you need to check. You need to see your doctor at least once a year to get it checked. All right?
Don't wait for the signs, lah. Don't wait for the signs.
Yeah, yes. Prevention
So
is
is this
always better than
example?
cure, Sakina.
Yes, that's true. Is this a
Yeah.
sample what the patient will get if they go for a heart screening?
Well, you should actually speak to your doctor. So here in Colombia, Asia, we do have got a lot of heart screening tools that we can do for our patients. As you can see here, we do have simple tests like stress test, exercise stress test. We have got echocardiogram, ultrasound of the heart that I mentioned, that able to tell whether the patient who has got heart failure or not. We have CT scan
Yeah.
of the heart to look at the blood vessel of the heart, whether there's any blockage. Do have some basic blood tests to screen the risk factor of getting heart disease. And of course, we have angiogram, angioplasty services to our patient as well.
I see. Dr. Tan, out of these tests, which is the one that is
Yeah.
really to the point when it comes to diagnosing heart failure? Now, I'm sure they all can identify, lah, but the one that
Mhm.
we really want to see things in detail, which is the one that is most accurate?
I wouldn't say there's only one particular test that can actually tell once who has got heart failure or not. There's usually a mixture, or rather a few tests that will tell us to clinch to a diagnosis. The more important would be, I would say, echocardiogram, the ultrasound of the heart would be one of the two, and X-ray, ECG, and also that blood test that I said earlier on, the NT-proBNP, that would actually tell us to guide us as to whether the patient who has heart failure or not. I guess it is a very comprehensive testing to tell one who has heart failure or not. So it's best to, if you have got symptoms, you do not feel well, you feel tired, you feel short of breath, you have got leg swelling, I think it's best to see your doctor to see what are the tests that can be done for you.
Yeah. If you see a doctor for heart screening, it doesn't mean that you have to go take all these tests. Like, it just depends. For each patient is different, I suppose, depending on what the discussion is between doctor and patient.
Yep, I would say so. If you are not sure what test to take, what screening package that you want to take, never mind. Just get your consultation, appointment with your doctor. Just speak to your doctor. I'm sure the doctor will be able to advise accordingly.
Okay, Dr. Tan, thank you very much for the very comprehensive explanation about heart failure. Now let's take some questions from our audience. We've got Ms. Joyce Cole. Hi, Dr. Tan. For elderly who are not fit to go for stress test, what other kinds of heart checkup would you recommend other than blood tests?
Well, for those, elderly, we do understand that they can't they can't do stress tests, but we do have other modalities. For example, even a cardiac CT that will be able to whether the heart vessel has got blockage or not. And of course, we do have a that can stress the heart in using a medication to stress the heart in replacement of the physical stress that can actually tell us some idea what is the heart function is. Simple echocardiogram, ultrasound of the heart can actually tell. It depends what are the questions or answer that we want to look for that patient. If the patients that we are seeing, we are looking for the answer of whether the patient has heart vessel blockage, then CT scan will probably be the answer, or cardiac MRI. If let's say the patients coming to us, they wonder if they have how's their heart function, whether they have got heart failure, then echocardiogram, a simple heart ultrasound would be the test that we would do. Yeah.
Okay, let's take a question from our regular viewer, Mr. Rajesh Paul. Hi, doctor. Which cooking oils are good? I suppose this has to do with, because there's so many types of oils in the market now, and they all say less cholesterol and all kinds of marketing messages out there. But how do we know which ones are actually safe or the most?
Well, Sakina, I'm not sure if I'm in the best position to answer this question. This is supposed to be answered by a nutritionist or a dietitian. Well, if I may, if you allow me to say something about oil, then of course, vegetable oils will be better than the other oils. If you corn oil, sunflower, those oils, olive oils, those are the better oils. If you're using butter oils to cook, that would be choose those with not those with polysaturated one, monosaturated fats. Good fats are actually important. You are not advocating that you actually stop using oil, but healthy oil is actually essential. I guess if you want to know in details, I guess it's best to speak to a dietitian and nutritionist. Yeah.
Yeah. I think that was quite apt, actually, your answer. I hope that answers your question, Mr. Rajesh Paul. Ms. Chan Lee Hong. Hi, Dr. Tan. How frequent do we need to go for intensive heart checkups like CT, angiogram, calcium scoring?
How frequent? Yeah, that is a very I suppose a very good question. How frequent do we need to do that? Well, if it depends on the patient's symptoms. You see, if you have got, let's say for example, you have got one CT scan of the heart or the blood vessel done recently, calcium score has been done recently, which is normal. If you do not have any symptoms that is unusual, probably that you do not need to repeat it. But if let's say, for example, after you have done a CT scan or calcium score, but it was normal, but now that you experience something different, you feel there's a chest pain, you do feel as you walk, you have got chest discomfort. As you walk, you feel that you are short of breath. You don't feel well. Your stamina has come down. You're concerned about your heart. Then you should actually repeat, be it a CT scan or any other test to actually evaluate your heart further.
Yeah, or otherwise you could just go for health screenings. Generally, for a normal person, an annual health screening should do it.
Yep. Anyone who has got, well, generally we advocate those above 40 to have got should go for a yearly medical check, which includes a simple basic blood.
Yes.
And if they can, a stress test would be a good basic screening tools to the heart. For those who are younger than 40, that would depend on whether do they have any symptoms that of concern to the heart.
Yeah. Okay, we've got one more question here from Scarpun. Hi, Dr. Tan. Is there a healthy time frame between meals and sleep?
That's a very good question as well. Generally, one should meals and sleep. One should generally be a gap of between 4 to 6 hours. That is very important. That is not just because to the heart point of view, but to our digestive system as well. Because we notice a lot of patients, they have got reflux disease, they have acid reflux disease. So if they take their meals very close to their bedtime, or rather if they take very heavy or full meal before they sleep, they tend to get this heartburn or indigestion or feeling fullness and acid reflux symptoms that may mimic chest pain. So we generally advocate not to eat the meals to the sleeping time, not to be too near. And of course, eating a bit too late is not good in the sense that would your metabolism has come down because you're not doing work. By the time you eat, you are going to bed. Not like daytime, you are going to do a lot of work. You're walking and this and that will actually help to metabolize the food that you ingested. So generally, we avoid advise one to take a large amount of meal before they sleep.
Okay. Oh, suddenly the questions are trickling in. So, okay, let's take 2 more questions. This one is by Miss Alice Chong. What is the main difference between cardiac CT and cardiac MRI? Sorry.
All right. The two modalities actually provide different answer, I would say. Depends on what we are looking for. A cardiac CT will be able to tell us the structure of the heart. That's number one. And also it looks into the blood vessel of the heart, So if our concern or our what we want to know is whether the blood vessel of the heart has got blockage, CT scan generally is the test that we go to. But on the other hand, cardiac MRIs looking into one, cardiac structure, and cardiac MRI with stress, we look at whether the heart has got likelihood of any possible blood vessel blockage, but not directly looking at blood vessel, but we rather look at the heart muscle. If let's say we compare the image, resting image of the heart, and after the stress, after we stress the heart, we compare the image. If there is a weakness of certain part of the heart, then we can imply that that particular muscle, the blood vessel supplying to that muscle is actually possibly having blockage. That's what we are looking at the different things, but both has got their usage and their importance in diagnosing heart failure, heart vessel blockage, and heart structure problem. So it really depends on how the cardiologist or the would want to arrange the test for.
Okay, we've got time for one last question. Usually, this is by Ms. Marilyn Tan. Usually, what kind of symptoms for us to know if there's any heart failure? Does heart failure also mean the main arteries have blocked more than certain percentage?
Okay,
maybe very briefly without going into all the symptoms that we discussed earlier.
Well, yeah, symptoms, we talked about just now, the 3 main symptoms. If one who has heart failure, usually they will find that they are short of breath as they do work, as they walk, as they climb the stairs. They feel that they are tired easily. That's number one. If they feel that they have leg swelling, that's also one of the things that they need to be concerned about. If they're unable to lie down flat, they find that they need to sit upright, need a few pillows to prop themselves up to feel a bit better in terms of breathing. That would actually tell us that the patients might be having heart failure as well. Catching up for breath, that's also a symptoms of heart failure. And if they have got cough, unexplained cough, if you find that you have been coughing, but it is not of infection in origin, you'll see a doctor that been prescribing antibiotics, medication, but it's not getting better. You feel short of breath, tired, and coughing. That you may want to see a cardiologist to assess whether you have got heart failure or not. And the answer to the second part of the question, whether percentage of blockage, well, we can't tell. One may have got the heart failure, but because as I said just now earlier on, there are many causes of heart failure. Of course, one being the most commonest is blood vessel blockage leading to heart failure, but there are
Yeah.
many other causes of heart failure without blood vessel blockage. So we can't tell, but just diagnosing one has got heart failure, we cannot imply that the patient has got severe blockage in the blood vessel without being investigated further. Well, if the heart function is low, the likelihood is that the blood vessel may have a very bad blockage, but that
Yeah.
doesn't mean they are 100% truth. They may have other contributing factors, for
Right.
example, hypertension, diabetes, other
Yes.
things that may cause the heart failure.
Okay. There's a question here from Mr. Encik Muhammad Hadi. Hi, Dr. Tan, how much is the price for all the tests? Okay, for this particular question, we will get some from the marketing department or customer care from Columbia Asian Hospital Seremban. They will get back to you and give you the answer that you require. Okay, one last question from Ms. Celia Chong. Is it true that it's bad to take a bath or a shower after a strenuous workout? Can this cause a heart attack?
I guess short answer is not true. Probably it's a myth. I have no answer to that, to be honest, but I don't think so that really relates to heart attack. If you have you have got heart disease, whatever you do may provoke the heart attack the symptoms, but not necessarily links to taking shower after a strenuous exercise. I guess it goes back. If you are not well, seek a medical advice.
Okay, thank you so very much, Dr. And thank you
Thank you,
for being
Sakina.
and for presenting such. It was very interesting and very, very useful. It's very comprehensive. So that was consultant interventional cardiologist and internal medicine physician from Columbia Asia Hospital Seremban, Dr. Tan Kin Leong. I would also like to apologize for the intermittent disruption because of connection, but it was only like 1 or 2 seconds and then you're back on. So that's not a problem at all. So we'll see you again during the next
Thank
Doctors Go
you.
Live. So goodbye. Thank you.
Thank you, Sakina.
Thank you.